Hi, Dr. McIntosh. I just wanted to come on here and respond to your question regarding how we could instill hope in clients who don't necessarily believe in the Bible or want a faith-based treatment. And as I was looking into this topic, I discovered mindfulness-based interventions and did a little bit more digging into that topic of conversation, specifically looking at mindfulness meditation as a component to effectiveness in increasing symptom reduction and mindfulness skills, which would result in the installation of hope in the treatment process itself. However, in a study by Canby et al., they talked about a meta-analysis that was conducted regarding MBIs, mindfulness-based interventions, and control groups. And in the control group, they experienced similar increases in mindfulness as those in the MBI group, which suggests that mindfulness skills might just be a result of common therapeutic factors and not necessarily can be solely attributed to the meditative processes of MBIs, which kind of leads us to look more deeply into the contextual factors of therapy, not necessarily the specific techniques we're implementing. And as I was looking into that a little bit more, I found a study by Psy et al. Regarding functional analytic psychology, which is really based on the contextual factors of behavioral sciences. And I thought it was quite interesting how they emphasize the therapeutic relationship as being a component for growth and transformation in a very authentic and mutually vulnerable way. And I thought that was quite interesting that it emphasized the mutually vulnerable aspect of FAP. Specifically, what this looks at based on this study is they target issues in the client's life as they manifest themselves in therapy. So not necessarily in the context of their everyday life, but as the issues come up within the sessions. And it's necessary to pay attention in those sessions to clinically relevant behaviors, or CRBs, as those responses correspond functionally to what is occurring in their daily life. And so with this in mind, there were CRB1s, which are the problems that they're experiencing, and then CRB2s, which are the improvements that you see within session. And so it's really important for therapists to be attuned to the CRB2s, what's happening within session, and maintaining that awareness to our clients, as this relationship, as it described in this article, is very vulnerable and very much transparent between the therapist and the client. And so the key principle there is making sure that there is a clear understanding of client goals and their concerns and the problems they're facing, because if we're not able to see the issues at hand within session, we cannot fix or help fix what they're going through. So they discussed in that study just a couple of things we can do as therapists to really instill hope and instill a strong foundation for our therapeutic relationship with the clients in that specific FAP session type. And that included creating trust and safety in the environment, which can be done with specific counseling skills like empathy, reflective listening, validation, and things of that nature. But it also discusses how therapists can be a little bit more forthcoming with these types of clients and, ask them questions about their reactions to what's going on, their reactions to the therapist, voicing their opinions. And that's why it's a really key factor that therapists are honest and genuine with these clients. And also moving the conversation from the context and where it's happening to the therapeutic process, like where they're at specifically in therapy now, kind of grounding them in a sense and making them a bit more present within what's being experienced in therapy. And I think that awareness of the therapeutic process is a way of instilling hope, because then the client can see firsthand what's happening around them. And then lastly, they discussed making positive statements towards clients, expressing our excitement to work with them because you see motivation with them, or just being so genuine about the progress that you see with them. That is so crucial for instilling hope in clients, specifically because not all the time. It's really hard to see your progress as it's being made, but other people see it. And having that motivation from someone who's your support system in the role of a therapist is so necessary to push forward, especially in the difficult times. And I think that these types of techniques would be really effective for someone who wants to be in therapy and needs some hope instilled in them to move forward, but doesn't necessarily want to incorporate biblical teachings into their practice.